News Radio 600, Kogo.
The Food and Drug Administration has given permission for a large clinical trial of ecstasy as a means for the possible approval of a prescription drug version of the stimulant.
Now, why would they do such a thing? Expert on PTSD, Northwest Battle Buddies head Shannon Walker is with us here on the Kogo News Live Line. And it's not just a stimulant. Isn't it a little bit of a hallucinogen as well?
It is. It's definitely a highly addictive, feel-good drug that not only is it highly addictable, but also causes long-term brain damage, severe brain damage long-term, if they keep doing it. So I don't understand why they're looking in this direction when it's a temporary relief of symptoms, when the side effects and the risks are so high.
Well, that's going to be, let's walk it back a little bit. That is going to be my question. How do they think that ecstasy affects the mind of someone who has PTSD?
You know what? I'm not a doctor, and I can't answer that question like that. I will say this. The fact that it's highly addictable and a feel-good drug, I think society as a whole looks for an instant relief. And with what we do here at Northwest Battle Buddies by providing service dogs to combat veterans, we're looking for long-term solutions. And the people that support our organization, that's what they're doing. And, I've never met a veteran out of all we've paired 38 service dogs to 38 veterans in the last 5 years, 100% free of charge to the veteran. And I've never met a veteran who was looking for another narcotic or another prescription drug. In fact, they're most excited when they can either lessen their prescription drugs or completely go off of them after being placed with a service dog.
Now,
and so, go ahead.
Well, the way that this study worked is they saw about a 56% decrease of severity of symptoms on average, and they also found that those improvements lasted more than a year after therapy. So what if it's just 1 or 2 doses and then that's it?
Well, honestly, understanding PTSD the way I do, and the way that I've seen the veterans affected, I find that hard to believe. But then it also makes me question, what was the percentage of disability of the PTSD of the men and women that were involved in that study? There was only 130 men and women involved in that study. And so it makes me wonder, the men and women we deal with they're almost 100% disabled because of PTSD. And so the question I had when I read that was, what was the percentage? Was it very, very low? Then maybe I could see that it might have some benefits in that way. But at the same time, I think as a society, we're looking for a quick fix, or we're looking for a pill to fix everything. And I just don't think that's a safe road to be going down, especially when our American heroes deserve the best. I've just never met one of our any veteran I've spoke with that is looking for another narcotic to be the answer.
But if this is a breakthrough, and if it is approved, and they're saying it could be available by the year 2021, would you be open to people who have PTSD at least giving it a try?
You know what? I don't want to be closed-minded about it, because obviously I'm not a doctor. And so if we could actually find something that does help our veterans and our American heroes move forward, or at least be a bridge to something else to where it keeps them going so they don't give up, considering the suicide rate is 22 veterans a day. If it helps in that way, then absolutely, even, no matter what my opinions are, if it works and it helps, then it helps. I'm very skeptical about it, just because of what I do know about the drug, which I will say is very limited. But even the experts are saying their concerns is how addictive it is, the abuse of it, and the long-term brain damage that can be caused by it. So I guess it remains to be seen in that third study. Hopefully it will help answer a lot of these questions.
All right. She is the head of Northwest Battle Buddies, Shannon Walker, also an expert on PTSD on the Kogo News Live Line.